Just in normal circumstances, what are the vaccines that maybe your wife or sister or any other relative of yours might be getting from her gynecologist or might be advised? So there aren't too many vaccines. It is important to know that we try and limit the amount of medicines that a woman is exposed to. It is important to keep the pregnancy as natural as possible. So we just give nutritional supplements, an iron, a calcium, a protein supplement. And even as far as injections go, when we come to vaccines, we really give only 2 or 3 vaccines generally. The first or the most commonly given is tetanus toxoid. So what is really tetanus toxoid? So in simple terms, tetanus toxoid is a national immunization program. It is given all across the country because tetanus is a prevalent entity in our country. So in tetanus, what really happens is that an organism or an infection occurs, and this causes certain complications in not only pregnant women, but in general in both men and women. So in order to avoid this, and there is a potential, of course, for the pregnant woman to have a delivery by a cesarean section. So during cesarean section, there is a cut which is made and there is instruments which are used in order to deliver the child. So if this scenario does come up, it is always better that a woman is immunized with tetanus. So this injection is given, usually the first one is given between 16 to 20 weeks of her pregnancy, and the second one between 24 to 28 weeks. It's usually given about 4 to 6 weeks apart, and one gets one injection on the buttock at one time. So totally there are 2 injections. One gets it in the muscle, usually in the buttock or in the arm, and then one might experience some pain. It will be slight, usually it goes away in a few days, or some arm heaviness or leg heaviness. This is fairly common. Apart from this, another injection or a vaccine that a pregnant woman might get is the vaccine against the flu. So this is really against a flu virus. It is not the vaccine against coronavirus, but there are other viruses out there which can cause a flu. So in order to vaccinate a woman, one gives a vaccine usually in the 3rd trimester, that is in the last phase of her pregnancy. And this again is given in the muscle, usually on the buttock. And these are really the main vaccines that one gives. Additionally, if a woman is susceptible to a certain disease or an immunosuppressed state, if her immunity is low, a gynecologist might advise additional vaccines. But in a normal pregnancy, in a normal woman, these are the essential vaccines that one will get when one visits a gynecologist.